Hi, I'm Dr. Pannozzo. Thanks for watching our program. The patients you're going to see are regular patients from my practice. Whatever they say on camera is how they feel and what they want you to know. So enjoy the program, and if you have any questions, write in and we'll answer them. Thank you.
What was that again?
She has a book. We just went to the library, picked it up. She's gonna
I
read.
think the best one is O'Reilly's book.
All right.
I like the way he writes.
Yeah.
And he's writing about that very subject.
Is he? Oh, I didn't know that.
And he is a historian by trade.
He is, yeah, he's a great guy.
Hey, what's the trouble, baby? Oh, what did I do with the chart?
Your shoulder.
Yeah, so.
Well, why don't you stand up and show him your
No,
deformities?
just tell me first, then we'll
Okay.
examine you. Good. Shoulder?
What's wrong with my shoulder, Mom?
You have to tell me. She doesn't.
I wasn't
was-
planning on coming here.
I had her captured after the library, so.
Smart.
Yeah, can you lay on it?
Yeah, it doesn't hurt.
What is shoulder? What do you mean by shoulder? Right there.
Like, what do you think is wrong with my
This is
shoulder?
oversized,
shoulder.
very
Oh, you
oversized.
mean the muscle
Yes,
there is
that's what we're talking about. Show him, yeah, show him.
yes, compared to this one, so because I work out this arm over this. I don't know.
So there's no pain at all?
No.
How long has this been like that?
Probably like a year.
Here?
Yeah.
Does it bother you when you swing the, no? How fast can you hit it?
I don't know.
Your serves never been clogged?
Never been caught, no. It is pretty fast.
Gotta be at least like 115 or 112.
Were you winning?
Yeah.
Played a big tournament this weekend.
Does your neck hurt?
Yes, it
I
does.
know it does. But that's probably just because I suffered.
No, it's been hurting for over a week.
It stopped, it was like for 2 days and it stopped and then I did something again and now it hurts.
Does it go anywhere? Do you feel it in your arm?
I just feel it here.
Have you had any treatments on this?
No.
No x-ray, nothing?
And then she also has the leg problem, like, what is it called? The
Hip?
Like her hips are coming in and her knees are going out. There's a name for that, I forget what it is. Schwarzers or so, I don't know. But her hips are out and her knees are in, so it messes her movement up.
Okay. Very good, very good. None of us stopping the playing, though, right?
No.
Tennis players are tough people though.
All right, let's see. They'll carry you around. I want to see about this hip here. Okay. Right there. The hip does not allow this leg to come out. It should be up here, see? It won't come up. And the reason is inside the hip joint, there's a ligament there. And that's treatable.
Treatable?
Yeah, very treatable. It will affect the knee eventually, so
Right.
you want to get this taken care of quick. Does your lower back hurt?
No.
How often does it not hurt?
Well, I guess it kind of been hurting.
What would you
That's
do?
because of my serve.
Why'd you bring me here, Mother?
No, the back shouldn't hurt. Serve or no serve.
It hurts like only when I serve, not any other time.
You must be arching your back a lot.
Yeah.
Yeah.
You even got your tennis shoes on.
Bring
Look
this
at
knee
you.
up. Hold it there, don't even push it down, hold it up. Okay, this one.
She's also been sick for about 7 days. Can't get over her sickness.
All right, put your chin straight down. All right, does that hurt anywhere?
Not really.
Hmm?
I kind of feel like a little bit
Okay,
here.
this is your neck we're looking at. Doesn't hurt then?
No.
Chin all the way up then. Way back. Go back, go back, back. How's that feel?
Doesn't hurt.
What?
It doesn't hurt.
Okay, good. Chin over here. Chin, chin.
This hurts.
Your other chin. Over here.
Hey,
Where does that hurt?
It hurts here.
Right on the right side. And the other way. That's much better. Does that hurt? Going to the left. All right. All right, let's turn you this way. And let's look at your shoulders. Drop your elbow in my hand. Hold it right here. Don't let it push it down. Hold it up. That's a completely normal shoulder.
Yeah.
Put this hand up here, raise your elbow. And that's completely normal, right? So the neck is got to be referred into that. What about this one?
Yeah.
Not this one, but this one, right? No,
Yeah.
this one here. This joint goes to here, which will put her off a little bit. So what we would do, and worry about this, because that's all wrong now. There is more muscle there, but did you do exercises for this?
that's typical of what tennis players.
Yeah.
I mean, Roger Federer has one arm bigger than the other, you know.
But
you
it's
look-
just right here. It's a goofy place. It's not so much here. Like this.
She had a lot of
Well,
flings.
this is the muscle that pulls
Yeah, right.
is right here,
Okay.
and there's the tendon for it, right through here. But the exam is fantastic. If it doesn't show anything here, you don't have it.
Yeah. Okay.
But she could have curvature here, which is what she has, I think. Stand right there. Now you see the shoulders up?
Mhm.
Okay, that means it's got a curve in here.
You just get a, sorry.
You know any athletes
turn
that
her-
see this?
can you turn her?
They're not treated right.
Good, like that, yeah.
Yeah, this is
Higher.
rotated and higher, so that means it's a curve right here. She has a curve this way, which is why the neck hurts. So when the spine is rotated here, see it?
Mhm.
It's flat here, bulging there. That means the bone structure is actually turned. And that's going to turn everything. So she will she'll do whatever she needs to do to get that ball over there. She's a real tennis player, you know, in spite of this. And that's why you get the big muscle here. All right, so this was 2, 3, looks like a T4-5, T5-6. Okay, so that's a scoliosis. Don't get frightened of the term, it just means the bone's turned. Why is it turned though? That's the question you want to ask.
Mhm. So we've had lots of tennis player friends who've broken their back, and mostly lower. But so
Well, why she's turned this way is an injury in the bone structure between the dorsal spine, this one. There's a ligament there that she injured somehow, which tightens down and turns that bone. So we unloosen it, it'll come right out. Excuse me, stand right here,
he's too
and
old.
face that way. There you go, come back towards me now. Now, I want to keep your knees stiff and just bend at the waist. And I'm trying to find the pain here, go ahead. Where does it hurt? Oh. Does it hurt anywhere?
No.
Go more. Good. Come back up. Come back up. Bend back towards me now. Where does that hurt? Doesn't hurt? Go left. And to the right. Watch that hair. So your back looks pretty good, right? Except it's a little crooked right here. And when she bends forward, it rotates a little bit. See? So, and it's crooked right here. That's a joint there. And that will hurt you occasionally. So let me count these things. 5, 4, 3, 4. Okay, that's it.
That's it?
Now what you expected.
Now what do we do?
Shoulder's good, she has scoliosis, which is correctable.
Okay,
In fact, we just had a 15-year-old, how old are you?
15.
We had a 15-year-old in here yesterday.
With the same thing?
Yeah, and,
You had a boy here too, there was a picture that he turned,
More to.
was it a pitcher?
yeah. That was the kid that knew the other kid that got 5 home runs in one game?
No, that was the shoulder.
Okay. He had some back too.
The other kid was a weightlifter,
Oh,
and he had the same problem
Yeah?
between the shoulder blades.
So what do we do?
Uh-huh.
What do we do?
Well, you take shots for it.
Shot? Oh, my husband, you gave him the toe in the toe.
Uh-huh. The same stuff. It just softens the ligaments and allows the bone to turn. It's most sophisticated, it is the best you can get. And don't be afraid. That 15-year-old,
Was he scared?
yesterday, she took those. I gave her 2 shots in her shoulder, and her spine turned normal while we were watching her.
Really?
Yeah.
Well, my husband's been good with that too. Here it is, this is what I'm looking for.
Well, what do you think?
I didn't think I had a problem with it personally.
No.
You know what that is?
yeah, I can't remember his name though.
What's his name?
Who? Burnage.
Burdage.
Oh, Thomas.
He was, you had said that about going there, we were there when he was practicing.
He's tall, huh?
Yeah.
Yes, his toss is way too high. Do you know him? No.
No. Yeah, well, that's my job to find out if you have a problem.
Okay.
No, the thing about it, if you're serious about the tennis, you want to get this fixed. And that's kind of the thing. But if you're just concerned about your health, you want to get this fixed because you don't want to grow over this.
So how do we fix the knee too?
The knee, I don't think it's
The hip was off, you know? She said that her hips couldn't bend all the way, right?
Oh, the hip there.
Yeah.
Yeah, well, that's a shot too. These are all shots.
Okay. All right, well, let's do it today.
No, not today.
No, it doesn't hurt. Father even said he was surprised how it didn't hurt. Yeah, it'll be fine. And you're here and we're here. Can we do it today?
No,
Yeah,
No.
which ones do you want?
All of them.
no. Okay.
No. We're just saying, it doesn't hurt. It's not a normal shot. Yeah, stay. Go sit
No, it
down.
doesn't go in your muscle. It goes in a ligament. It's very acceptable and very fast. But
Okay.
the result is fantastic.
The result is fantastic. Father says it's
Listen.
fantastic.
When you go to someone and you get sophistication, take it. It's all
Right.
The trouble is you get to be 22 years old, 24 years old, and you find out you have this curvature. You can't wear a strapless gown, and you're going to have trouble between your shoulder blades, and you're going to go to someone who wants to operate you. Don't do it. Eliminate yourself from that. You don't need it. If we take care of it, it'll straighten out. You can actually see it. You're going to see it. And you don't have to worry about it after that. It doesn't go back. See, once it's fixed, it stays fixed.
And we don't need to go to the chiropractor?
Oh,
no,
especially
stay
don't-
away.
I also work for Lou, by the way. That's how I found you. And I know he was going to chiropractor till he came to you.
Oh, Big Lou.
Biggie Lou,
Everybody knows
yeah.
Big Lou.
Yeah.
Yeah. We gotta take a couple pictures and then you can make up your mind.
French guy?
She's off 3/8 on the right.
Here, come look at your pictures.
See, this is the top of the right hip, this is the top of the left hip.
Mhm.
This is because it pulls on the ligament. And, no, it's the right one. This is the right one.
This is right.
The back looks pretty good, except this right here where it's curved 5, 4, 3, 2. Right there is rotated a little bit. But that's fixable. We have to give you something to wear in your shirt. The reason she stands with her knee bent is because the leg lengths are not. And she's trying to change that.
Trying to fix it right as we speak. She's trying to fix it right as we speak.
Trouble is, you can't fix it. You have to, it has to be external.
Did you say 3/8?
All I have is half second. Yeah, the 3/8. All right, this is, oh, you smell leather? It's premium leather.
Handmade.
These are made in Ohio. They're made by hand.
Yeah?
You can see the mark. It's all sanded down. It's the way out. This goes in your right heel. Go ahead, put it in.
Maybe we should tape it in. Though.
Yeah, we're going to tape it in as soon as we get where the tape is. I should have tape down here, shouldn't I?
Yeah.
Go ahead, take.
Get off. If she's off by that much, she needs to do that. This is saving her an injection.
You can see the curvature there. It's not that bad. I think it's caused by this one right here. E23. And see how the bone is turned and it's gone to the left right there. So we could fix that. It's 2 little shots and it comes right out.
And then what about her neck?
And the neck is a subject to this. So the neck is 5'6" right here. It doesn't, see, none of these show that much. They're there by clinical exam, but if we take care of between the shoulder blades, probably the neck will just disappear.
Okay.
And you get rid of the problem there. What do you say? Yes, no?
She's excited.
I always tell my own kids, you think like an adult. Make a decision
Exactly. How
that's
many
gonna
times have I told
affect
you?
you in the future.
Right.
Don't think about now or your friends, you know. Just gotta
Right.
make a decision right now. What do you think, Cassie?
You can say yes. Okay, let's do it. It's just a little picky one.
There's nothing to it.
Just think of it as another tournament.
Right.
Can you come in and hold this?
Me?
Yeah.
Yeah.
You just,
Go around the other side.
Okay.
She won't want me to take this off, so you just hold it over.
Uh-huh.
Have it get it out of the way and then we'll see. Did I put it in there? Really?
no. No, you went right to her.
Yes, I
Oh, you did? Well, you did that fast because I was.
did.
Did you save that one? So you're gonna save it so you can show the tournament.
Can you save it?
Oops. Good.
Here we go, kiddo. Wish me luck.
Breathe.
Is she breathing?
Breathing.
Yes, she's breathing. I think.
She didn't even make a sound, really.
Ah, she's a terrific kid, I'm telling you. This one's good. Yeah. I don't have to hold it anymore, but we'll watch it. And then when she gets up, you'll see that the curtain's gone.
So how did you develop this?
Did you snap him on the jump? Yeah, it's really technical.
Call myself brainless sometimes.
And you had the famous hockey player here too.
Jerry Cheeves.
Yeah, I work with her. Well, and Lou and her.
I think it already turned.
He saved Jerry Cheeves from having knee surgery, a
Really?
replacement. Yeah.
Yeah, that's pretty straight now already.
And he only says great things about you.
It's only been a couple of minutes. All right. Okay, you can come out now. Did you survive? Speak to me. All right, roll over. All right, so that's where we were. You can see it. This is the first one. See how crooked that is? And here's the last one. See how straight it is? Did you see it? See it's crooked right here? This is rotated. It's derotated already and straight. It's a three-dimensional turn. You only see it two-dimensional. But the whole bone itself is turned inside your body. Okay,
Thank you.
yeah, let's take a look at it.
I have like a little thing over here.
That's right, you're supposed to do that as an exercise.
Okay.
Squats.
The squat. And the pain is over. And then, when I flex complete over here like this, it's something over here.
Yeah, that's the rest of the squats. Still under the patella though.
Is there any patella?
Yeah, it's
Okay.
not your knee at all.
Okay.
That's good news.
Yeah, that's perfect. So what should I do now? Just wait for it?
No, if you lay down, I'll look at it again. Go ahead and lay down. This way.
Pressing, I don't feel too much pain.
No, you only feel it when you put a stress on it.
Exactly.
See, and I'll tell you where it's going to be. It's going to be right here. Yeah, right here too. Right there.
It's most of pain, like I can put some pressure is in the
Yeah, this is the only place that doesn't move. See, when you examine this, the whole thing has to move around. And if it doesn't move, it's because there's something stopping it, and it's usually scar tissue.
Right.
Not a real scar like a slash, but just tight tiddly ones. Yeah, so this got to be good. Then it's got to be here. Feel that? Your knee is down here. That's not going to be
Right.
your knee. It's going to be right here.
Right there, yeah.
All right.
It's something. Yeah, what,
That's right.
Right here.
That's right.
Okay.
You want me to put a shot in it?
That's the best way?
Yeah, because this is a big area. And
Right.
if you want to be really active, you want the looseness that we can give you. And you only can get it that way unless you exercise it.
All right.
You know, and then you hurt yourself and you say, oh, well, I got to pay.
Exactly. even though you're a nice guy, I don't like to come over here every week, right?
It's okay. If you're gonna save your knee, it's worth the trip.
I know. You remember my grandpa, you know? My grandpa was a doctor.
What happened?
Can you remember my grandpa? My grandpa was a doctor
Oh,
in Chile.
oh, in Chile.
But he's like the old style of doctor. You know, that you and say you have this one or this one. I know today you have a lot of liabilities on it. You cannot do that, right?
Well, we try to put a little more science to it than just touching, you know. You have,
Yeah, sure,
you
of
have to know a
course.
lot of stuff, you know.
But any doctor that you go, am I right?
Yeah, because they don't examine. So we actually examine people. We don't use MRIs.
That's nice.
The MRI guy doesn't know as much as I do. Why trust him?
Exactly why, right?
How's your knee? I mean, do you feel a little bit better right now, or is it too soon?
I think it's too soon, you know. But I hope it's gonna be okay. The first day that it came, like I said, was like 70% was off or more. But I think it's to do some activity. They come back, of course, much less. And now feel good, but we never know, right?
Yeah.
This is funny, it's still hurt right here. Right here. I think it's normal or not.
Tell him.
Doctor, let me ask you something. When you do this squat, look at this. It's still hurt right here.
Yeah, keep doing it. You want to stretch that out.
Yeah,
it's a good exercise to do.
Exercise and
Yeah, because I got it up above.
Mhm.
So you're feeling it down, but it's actually I got it up in here.
Mhm. Yeah, because the pain's a little bit under.
Yeah. Yeah.
Right here. Very good touch.
Yeah, well, I can get that if you like. Just-
No. Do what?
I can go and get that.
Really?
Yeah. Just later. Just keep it off.
I can tell it's much better.
Do some squats. It's much better.
Mm-hmm. Oh yeah, that's nothing now.
Nothing now.
I'm afraid of it. Oh yes. That was the one. Now it's completely gone. Yeah. After the second shot was better. Much better. Alright.
Happy camper.
Oh yes. Let's try to play again.
Okay, great.